Okay, so good morning. Please sit down. Okay, so my name is Dr. Celine, and I'll be your doctor for today. What is your name?
My name is Jessica.
Okay, so Jessica. So today we're here to have a counseling session for diabetes mellitus. So have you known that?
Yes.
Okay, so do you know what diabetes is?
I'm not sure.
Okay, so today we'll be discussing about diabetes, and my goal is to ensure you that you understand your condition and feel confident that in managing it. So diabetes, it is a condition where your blood sugar levels are higher than normal. This happens because your body doesn't produce enough insulin because you have diabetes type 1. So, so insulin is basically something that helps sugar from food to enter your cells to provide energy. So since your body doesn't produce insulin, you need insulin therapy. And if your diabetes isn't properly managed, it can lead to complications like heart disease, nerve damage, kidney problems, and vision loss. Okay, so first I'll be discussing about exercises. So exercise is very crucial for managing blood sugar levels, and I recommend that you have aerobic exercise which is moderately intense, such as brisk walking, cycling, swimming for at least 30 minutes for 5 days a week. So a total of 150 minutes per week. And since you don't have any contraindications such as osteoarthritis, uncontrolled hypertension, retinopathy, and nephropathy, I recommend you to do resistance training as well, and also strength training like lifting weight for twice a week to improve muscle strength and improve glucose metabolism. And you can also do yoga to improve overall wellness and reduce stress. And you should start slowly and increase the intensity of your exercise as you feel comfortable. And always to monitor your blood sugar before and after exercise to avoid low blood sugar or hypoglycemia. Okay, so next about the diet. Are you clear about the exercise?
Yes.
Okay, so about the diet, here is what I recommend. So you have to control your carbohydrate intake to choose complex carbohydrate like whole grains, legumes, and vegetable, and to avoid sugary drinks and carbs. Also, for fibers, you need to eat food rich in fibers like vegetable and fruits, nuts and seeds to regulate your blood sugar. Also, healthy fats like olive oil, avocado, and fatty fish like salmon. Also, have a balanced sleep. Use the plate method, and also regular meal timing. So you have to eat in smaller plating, balanced meal every 3 to 4 hours to prevent blood sugar spikes. Okay, so you have to limit processed food, saturated fat, and high sodium options. Yes. And if you like, I can help you develop a meal plan according to your disease. Okay, so next is for the treatment plan and for the medication. So your treatment plan includes the lifestyle modification, the exercise, and the diet, but medication is also necessary for you because your diabetes level is already high. So I will prescribe you oral medications like metformin, which will help your body use insulin better, and also insulin therapy. It's to provide you with the insulin that your body is not producing, and also other medication to control your blood pressure and cholesterol. And you should follow the dosage and the timing that I prescribe. And if you have like any side effects, please let me know immediately. Okay, so after that, it is very crucial for you to monitor your blood glucose level. So do you know how to do that?
Yes.
Okay, I will ensure that you know it more, and I will explain it again. So first, we'll start with routine blood glucose testing. So this will help me understand how well your treatment is working and whether I need to adjust any dose. So for the time, there is 3 times. times. First is the fasting blood glucose. So you test your glucose level first thing in the morning, and postprandial, which is 2 hours after a meal. So helps us to see how your blood sugar responds to the food that you eat, and also periodic testing. So it's based on your need. Next is we have HbA1c testing. So this shows your average blood sugar level over the last 8 to 12 weeks, and it will help us to evaluate how well your treatment is working over time. Okay, so that is it, and there's also self-monitoring for blood glucose. So you can do this at home and using a glucometer. So there is 5 times when it is important for you to check. First, it's before the meals, and then 2 hours after meals, and before bedtime to ensure that your levels are safe when you sleep, during the night if you're at risk of low blood sugar while sleeping, and last is when you have symptoms. So if you feel shaky, dizzy, or unwell, you should test your own blood sugar to confirm whether it is too high or too low. So that is it for the monitoring blood glucose. Do you have any questions or are you clear?
I'm clear.
Okay, so do you have any questions for me?
No.
Okay, so we're done with the counseling session. Please remember about the points I told you about the exercise, the diet, and also the treatment plan such as the medications, and also when you should monitor your blood glucose levels and how. Okay,
Thank you, Doc.
thank you.